More than half of our patients come from out of state and out of the country to see Dr. Agha because of many of his proprietary procedures. So for the process for a patient coming from out of state is a little bit different than a patient who is local. So there's different consultation options for a patient who is coming from out of state, including a virtual consultation. So within their virtual consultation, the patient will send in photos so Dr. Agha can review them, put together a full surgical plan, review all of their intake paperwork, and then they would have a Zoom call with our surgical coordinator to discuss all of the surgical details. So during that call, our surgical coordinator will go over the plan created by Dr. Agha. We'll go over any travel, stay, and recovery. Recovery is entirely dependent on the surgical plan that is created by Dr. Agha. Different surgeries require different surgical recovery time. For example, for a patient who's having a high definition lower body lift, a 360-degree incision is created. So it's incredibly important that that patient is not putting stress, tension on those incisions, and that they're really allowing their body to heal properly. We also have a very specialized team. We have a very specialized practice. We have our own surgical center, our own surgical team. We have our board certified anesthesiologist that Dr. Agha has been working with for 15 years. And so we want to make sure that during that recovery period, our patients are getting the absolute best care possible. And we know exactly how to take care of them during that time. We also have aftercare nursing services that we work with that can go directly to where the patient is staying, help take care of them, help with any kind of dressing changes, help educate if there is someone there taking care of them. And so typically for a high definition lower body lift, we require patients to stay in the Orange County area for 4 weeks. It can vary, again, depending on the surgical plan, but it's very important that that patient is really taking care of all of their incisions and not putting any kind of unneeded stress or tension on those incisions that usually comes with travel. Once a patient decides to move forward with surgery, we would get them scheduled for a preoperative appointment, which typically is 2 days prior to their surgical date, to minimize the amount of travel time and expenses, but we can schedule them for a virtual Zoom meeting with Dr. Agha if they do feel it is necessary or they have additional questions. In person, a patient meets with Dr. Agha at the beginning of their appointment, and Dr. Agha does a full assessment of their anatomy and puts together a customized surgical plan dependent on his conversation with the patient and dependent on what they're looking for, what's bothersome to them. When that plan's created, they will meet with a surgical coordinator to discuss all of the surgical details associated with their surgical plan. During your time with Dr. Agha, you can speak about anything and everything that you have questions on. Dr. Agha is a big educator, so he will walk the patient through their surgical plan and why he is recommending what it is he is recommending.